My name is Esteban Sek. I am a current student of California State University, San Bernardino. My paper today, we're going to be discussing about managing dehydration in enteral feeding clients. My name is Esteban Sek. Again, I'm a current student of San Bernardino, California State University, San Bernardino. I'm a current RN, presuming position in Riverside County Regional Medical Center. My purpose of my paper is to enlighten nurse awareness of the possible dehydration in this population with prompt intervention, as well as recommend the use of dual function feeding pumps. Hydration status in tube feeding patients can be usually maintained without hospitalization if monitored appropriately and on an ongoing basis. If hydration status is neglected, it can become life-threatening, according to Linda Lord, 2011. And due to the significant fluid alteration with use of tube feeding, clinical nursing assessment should be done with close attention to intake and output, body weight, and thorough bedside assessment. And even though there's not enough research to verify, there's a possibility that higher workload of RNs may alter the check of hydration status of these patients. So we also are looking into work staff load in terms of the variation why patients are not getting enough fluid and getting into the admission into inpatient so rapidly. And now, like I said earlier, the purpose is to increase nurses' early awareness of dehydration in the clients and to improve our ways of hydrating these clients in order not to continue bringing the increase of dehydration that they get into admitted into the emergency room a lot often. And of course, the encouragement to use advanced technology to improve hydration outcomes in these patients, which is by dual function feeding pumps. On my review, we as nurses provide quality care to a variety of clients from young to old, from perfectly healthy to chronically ill clients that cannot care for themselves. But for the reason of this paper, I'm going to be talking about the patients with enteral feeding through gastrostomy, jejunostomy, and nasogastric tubes. And to start with, for this reason, we serve as mandatory advocates for these people. And now evidence review says that hypocaloric concentration of feeding formulas make patients prone to dehydration, which may not be easily detected. And if the hydration status is ignored, it could be life-threatening. And then, according to the research with Mantello, 1996, Mantello, it says that the factor that increased admission rates in dehydration is because of heavy nurse workload that makes them not pay so much close attention to these clients, and also poor knowledge of implementation of how to go about the feedings and why we need these feedings. And to repeat again, if hydration status is neglected, it can be life-threatening. And also, based on the same evidence review, according to OSEO 2007, if we need to pay attention closely to our assessments in terms of intake output, body weight, especially lab values like the BUN and creatinine ratio, sodium. In dehydration status, it could be hypo or hypernatremic. If you have a dehydration status, you have the BUN is gonna be high, and the creatinine may or may not be high depending on renal issues. But the paper says if due to the significant alteration with tube feedings being with the hypocaloric concentration of the formulas, close attention should be done in closing clinical assessment. And Mateo, 1996, she declares that even though there's not enough research to prove that the higher the workload of an RN is, the less time RNs put in to checking flow rates and hydration in patients with tube feeding. And based on Linda Lord paper as of 2011, Bradley was one of the people that they sat down as a 4-panel interview and were interviewed on the need for hydration in clients because of the statistics of clients rising up. And he did say that use of automatic dual function pumps can save about 548 nursing hours per patient per year, which is about 30 minutes per shift of time taken off and wasting so much time at the bedside when you have to do a lot of things besides checking residuals and placement. My theoretical framework for this project is Newman system models, Watson's caring theory, and Kokaba's comfort theory. And we're going to be talking about, based on Newman system models, it says that every individual is uniquely defined by a variety of factors and characteristics given within a range of responses, supported by flexible lines of defense, normal lines of flexible lines of resistance, normal lines of defense, and the human core. And there are also many known and unknown stressors that have the ability to alter the stability of the flexible lines of resistance. And once the flexible lines of resistance is altered, the normal lines of defense gets attacked, which breaks the human core, hence failing to achieve optimal wellness and independence, which explains my point here that says stressors break through a person's lines of resistance and defense, altering the human core, hence decreasing optimal wellness. Now that is where we as nurses come in to advocate for them by being sensitive, exploring our humanistic values, develop helping, trusting, and caring relationships with our patients, and provide teaching as well as learning. Hence, we create and provide supportive, protective, and corrective holistic environment which aids in applying tertiary prevention, because at this time, since they're not doing primary, that they're already using feeding tubes to increase chances of survival. We are now applying tertiary prevention, which is adjustive processes as restitution beginning to promote the individual to promote to their maximal optimal wellness and independence of where they can handle. And when optimal wellness is achieved, the outcome of enhanced comfort is attained, which drives individuals, families, and nurses to engage in health-seeking behavior, which brings about more comfort. With more comfort attained, all participants of care are satisfied and will come to a consensus, which in return develops public acknowledgement of an institution's contribution to healthcare, which keeps it flourish and viable, and the evidence practice may be promoted through the theoretical framework. So in this case, enteral-fed clients rely on their feedings due to the inability to swallow through the mouth due to a variety of reasons, which promote the nutritional aspect of care. However, due to caloric content of the formula they receive, hydration becomes an important aspect of the regimen. With the care nurses give, we expect fluid volume status of these clients to be attained from inpatient to outpatient. And based on statistics, AHRQ, they are the Agency for Healthcare and Research Quality. they report that the amount of dehydration status that comes from home, hospital, home, nursing home, rehab, that go to the actual hospital for inpatient, and even in the inpatient setting, that they amount to about 139.8 per thousand person to report to the emergency room for dehydration. Now, because of that reason, they have developed a preventative quality indicator to be followed, because when you have this high of an amount, it decreases. When you have this high of an amount, it just shows that that our process of care is not followed adequately to drop down amount of dehydration, which, because dehydration can cause a marker of increased death within a year. So attributed to these cultural strategies are nurses' workload. So my opinion is, to achieve optimal wellness is to utilize the advantages of technology to partially reduce the workload of nurses, which is to use dual function feeding pumps that deliver water and feeding at the same time to effectively deliver hydration to our clients while we monitor them as well. And these pumps, which I'll show you in a few slides, I will tell you exactly how it works, and this puts my whole theoretical framework in perspective. This is the human system model that needs help, and this is the human system model that needs help, and we as nurses, we stay here, and this is where we want to achieve attainment and comfort and a viable institution. So with nurses here in the caring system, we teach our clients, we intervene to bring the patient down here to our comfort theory, and when this is achieved, and then this is where you bring this back to the patient. This is the stressors that cause this to look ill at the first place. And with all this said and done, we want to bring this. It continues on a cyclic process. It doesn't just go straight line and stop there. It recycles itself over and over again, which means it recycles to families, every entity, significant others, other caregivers as well. And the plan for this is, based on this project, we are trying to reduce the dehydration in admission and improve quality of life. So the plan right now is to introduce my project paper to my managers in my floor and also the other floors that have enteral feeding clients, and discuss about the need to implement and use these dual feeding function pumps in order to improve nursing care, which will possibly reduce the workload and tension among nurses and increase proper care offered. But prior to implementing this, I'm going to encourage the use of in-service, and in-service will be held on how to properly use the pump, the need to monitor placement status, residual checks, and lab status. And to add there is that it is recommended to use at least 30 ml of water before and after feedings, and it's supposed to be every 4 hours as well. And here is the pump in mind that I have about. This is a Kangaroo Joey pump. It's mostly carried by Covidian, and this is where you put the tubing. It's on the side right here, and this is how you program the pump, and it gives you the ability to adjust feed and adjust flush. If you can see down there, this is where it says to adjust the flush, and this is where to adjust the feed. So pretty much when you adjust the feed, it runs here, and you adjust the flush, and it tells you, you can time how often. It says flush how often ml, and every how many hours. So I mean, you can pretty much it usually regulates at the time when to flush it. And this is how the bags look like that we use on these Joey pumps. This is the exact bag that is used on this kind of pump, this two right here. You have the green bag is for water and the purple bag is for the feedings. So as the feeding is run through this bag, by the time the duration is given on the water, and then the water starts circulating from this bag. So I think it's a pretty good idea. It's a pretty decent idea to use this kind of facilitate the use of these pumps to maintain proper hydration, even if it's a lapse of about 10 minutes or so. But nurses can continue to check for hydration status, I mean placement status and residual status. This is how the enteral, and I also encourage the use of enteral feeding forms, and also request if we can constantly, okay, with evaluation, how we're going to evaluate how this is helping clients. We're gonna go with lab values. As I previously said, we're gonna check a BUN and creatinine status. BUN status is usually elevated when the patients are dehydrated. You're gonna check a BUN status to see if it's decreased from previous values when we first started. How well have we kept it below abnormal status, as well as the creatinine level. And we also gonna check our sodium level to see if it's within normal range, if it's not hypernatremic or hyponatremic. And we also gonna check our potassium status as well, and our chloride status. In terms of physiological integrity, we're gonna make sure that the patient are not we're gonna check the oral, their mouth, their lips, to see if it's not dry and cracked, if it's pink and moist. And we're gonna check for our brain scores to see how good the brain scores are in terms of the pressure ulcers. There's no development of pressure ulcers. Temperature status as well. We want to prevent fever, elevated temps. Any temperature that's elevated above 99.0, we are expecting to see that the patient may be hydrated. Not necessarily all the cases dehydration, but that's a possibility of being dehydrated. Anything below 99.0 is what we consider that our hydration status are properly maintained. Now we're gonna go back after using the pumps. We're gonna keep doing our in-services, and we're gonna figure out about our nursing surveys. Thoughts. Here's my conclusion. My conclusion says if hydration status is neglected, it can be life-threatening. And when a patient is hospitalized with dehydration, it's usually considered a marker for an increased risk of death within the following year, especially for clients with enteral feeding status. It takes a vigilant, educated clinician and caregiver to ensure that the tube-fed individuals are receiving adequate hydration. And according to Pash and with the Lord and the Linda Lord interview, he said water provides adequate hydration to maintain skin integrity status, a proper skin integrity, and prevent decubitus ulcer formation. And the Centers for Medicare and Medicaid Services will not cover the additional cost to treat a decubitus ulcer that develops during a hospital stay, because it can be prevented by providing adequate nutrition, hydration, and nursing care. Often, private insurance companies will follow suit with CMS. Non-payments of these costs will significantly decrease reimbursement to hospitals, so they are quite willing to adopt multidisciplinary strategies to prevent this from occurring at their facilities. And again, with proper in-services training and implementation, this goal can be met. Hence, reducing unnecessary hospital costs that cannot be reimbursed due to the complications related to dehydration, as well as decreased mortality rate per population. And my final word would be prevention is better than cure. And thank you so very much for your attention.